Here's a CT of the abdomen and pelvis that was performed on a patient with abdominal pain. And we can see here within the pelvis there's this gas-filled structure. I'll just put it on the lung windows to be able to show that this is indeed gas and not fat. But there's gas here within the structure here. This is the uterus, and you can see the uterine wall has been stretched. This is a patient who is in the 80s, and so the uterus is probably atrophic. Now, the gas here is within the endometrial canal. We can see the endometrial canal coming down here to the endocervical canal and then eventually to the vagina. The causes of air within the uterus, which is known as pneumouterus, can be a number of different things. And so one of the things we think about is, could this be from an infection? Could this be from trauma? Could this be from a fistula with the adjacent loops of bowel? And so it's important when evaluating air within the uterus to look at the bowel loops and see if there's inflammatory changes that may have caused a fistulization with the uterus. And in this case, everything looks fairly clean around the uterus, and there's no real abnormality in the bowel that's adjacent to the uterus itself. Now, we can better see this on the sagittal image. I always find that the sagittal is a better way to be able to visualize the uterus. It looks more anatomic, and here you can see this large amount of air within here. Now, we can think about air being caused by infection. The thing that argues against that is that there's no real fluid components within here. You would typically see in an abscess the presence of fluid and gas, and here there's no fluid, it's just pure gas. Doesn't look like there's any inflammatory changes around the uterus, and so this is probably a benign cause. This patient had over 10 vaginal deliveries, and so it was thought that this is probably related to incompetence of the endocervical canal, and air would come in here and get trapped within the endometrial canal. So this is just a case of pneumouterus, and in this case it was believed to be a benign etiology.